Hey, good morning, guys. Wanted to touch base. We didn't get to talk about this prior to the head to toe, so I want to give you kind of what my expectations are for this note because this is worth significantly more points than any other narrative note that you've done. It's actually worth 3 times more, so it's 15 points. No, it's 20 points. Excuse me, I believe. Anyway, so let's talk a little bit about how I want this to be done. Okay, so the head to toe note needs to be completed in a head to toe order. Okay, the rubric itself, I'm sorry, I'm kind of grumbly this morning. The rubric itself is written in a systematic order. Okay, so what is not going to work for your head to toe note is to go through and do your date, your time, your orientation, your general survey, mental status, your vital signs, then your cranial nerves, then you, okay, it's not going to work in this order. Okay, so you will still start with your date and time and your orientation, okay? Vital signs come next, okay? The reason that vital signs come next is because of the fact that we need that information to be at the very beginning of the note, okay? So remember when I started introducing the notes at the beginning of the semester, we talked about date, time, okay? Orientation status, and then your vital signs. Okay, so after your vital signs is when you will pull this in. Remember that all of your vital signs have to go in the correct order. I've noticed there's been some discrepancies here this semester. Okay, so temperature goes first. After the temperature, it's the heart rate, the respiratory rate, the blood pressure, the SpO2, and then the pain. Okay, there are points that are deducted if it's not in the correct order. A few of you may not have gotten your vital signs back from your proctor. I know Dr. Prosser accidentally kept a couple of papers with the vital signs on it. If you need your patient's vital signs from me, please email me and let me know. They're at school, so I obviously won't be able to do it until Monday, but I can email you the vital signs that were obtained during your head to toe if for some reason they weren't given back to you or you misplaced them or whatever. But what this note is intended to be is a full representation of your head to toe, okay? So I want you to put in your complete vitals that you obtained during your assessment. And yes, I do take your vitals that were provided during your assessment and compare those to the ones in the notes. So please don't make them up. Don't try and, this is a representation. This is how I'm assessing your ability to record your findings for your final head to toe assessment. Okay, so after the vital signs, then you can pull in things like your general survey. Patient is awake and alert, sitting in no acute distress. All of that sort of stuff can go in there. Okay, from there, you go into your head, eyes, ears, nose, throat, and cranial nerves. Okay, so most of your neurologic findings, I am so sorry, most of your neurologic findings are going to go in here, but they're not all going to go in there, right? Because the Romberg is something that we test at the toes of the body. So when you think about that, okay, the neurologic findings are going to be down at the bottom, like Romberg test and balance and all of those key things go down at the bottom, okay? Please note that you have to have 3 findings that are consistent. You will lose 1 point or a third of a point for each finding if you have less than 2 or a third of a credit. Okay. Next, you have your thorax and lungs. Okay, so 3 findings associated with your thorax and lungs. Okay. So that would be your lung sounds, lack of retractions, no work of breathing, anything along those lines falls into your lungs and thorax. Your cardiac assessment, please note here that I include your JVD, your carotids, your peripheral pulses, and your cap refill in your cardiac assessment, okay? But remember, head to toe order, so your JVD and carotids would actually go up here before you get to the lungs and the thorax, okay? So for your cardiac findings, you have to give me 3 additional findings beyond your regular S1 and S2 and your absence or presence of murmurs. Those both have to be included plus the 3 additional findings. So you're actually going to have 5 cardiac findings. And again, remember that our cardiac findings are going to be scattered throughout our head to toe. Okay, so you're not doing your lungs, your cardiac findings, then an abdominal assessment, okay? So this is a head-to-toe full assessment that is not systematically conducted, okay? Abdomen, I want 3 findings. One of your findings you will record is a normal bowel movement on whatever date, okay? So normal bowel movement today is 4/13/19, okay? That is going to be one of your findings. Other findings, you can report bowel sounds, you can report no pain with palpation, no difficulty urinating. All of those things fall in your abdominal assessment. Okay, your peripheral vascular and musculoskeletal, okay? You do have to document, okay? Bilateral, okay? Or, well, bilateral, and you also have to differentiate upper and lower extremities, okay? So if you're going to say strength is 5 out of 5, I want you to say that strength is 5 out of 5 to bilateral upper extremities, okay? With hand grasp, push, pulls, flexion, extension, abduction, and adduction with full range of motion intact, okay? So both upper and lower extremities. I'm going to ask that whatever you include in your upper extremities, you also include the same information in your lower extremities. The reason that I ask this is because it compares the top and the bottom, okay? The same as we're comparing right and left. We want to know if a patient has lower extremity weakness or if they're having difficulty moving, okay? So again, you're going to get points for your flow of the note. If something is out of order, you get deductions, okay? The proper format, again, a continuing paragraph with no extra spaces. I am looking, I don't want to know, I auscultated heart sounds and found this. It is just heart sounds were regular S1 and S2. There was no S3, S4, no murmurs appreciated, things like that, okay? Don't use the word appears. Patient appears to be their stated color for appropriate for their race. No, patient is appropriate color for stated race, okay? So don't tell me how you got the information. I only want the information. So lungs clear to auscultation, you know, things like that, okay? Don't give me a whole I did this, I did that, okay? Short, choppy sentences, no extraneous words. And again, your signature, okay, must be at all 3 correct locations on the note. So at the end of your note, you're going to sign your name and then SN. And then down in the signature box, you're going to sign your name and SN. And when you print your name, you're going to print your name and put SN, okay? So typically in the past, these are about 1.5 pages in length, okay? If you want to meet with me to have you help work your way through this, please do, because it's a very heavy assignment, and I'd really like to see you guys have a good foundation as you start to move off to 255 next semester. So that's kind of exciting. So the end is in sight. We don't have class this Wednesday because of Easter break, so please be sure to you know, use your time wisely and enjoy some sunshine. It looks like we have a beautiful sunny day out there today. And kind of gather up and start to get ready. When you come back from break, what we're going to do is we're going to start to work on prioritization. So it very much helps you to go back and review, start to review your topics, start to get ready for the final exam. We'll do some activities that talk about how we pull together pieces. We'll talk about focused assessments, okay? But really, the bulk of the learning is done now. Now we're figuring out how we're truly going to apply this in practice. All right, so I hope you guys have a fantastic Easter break, and I will see you rested and refreshed and back in the classroom in a couple of weeks. All right, toodles.